Grace and peace to you from our Lord Jesus Christ. I'm Gail Ford Smith, and it's my honor to serve as the director of the Center for Clergy Excellence for the Texas Annual Conference, where our vision is to serve the clergy and their families so that they can make disciples of Jesus Christ for the transformation of the world to the glory of God. Today, I represent a dedicated group of staff and volunteer leaders who bring you the 2018 Benefits Report found on pages 63 through 98 in the Pre-Conference Journal. In Board of Pensions Matters, which is chaired by the Reverend Dr. Jerry Neff, the past service rate will now be $876 for retirees, and the contingent annuitant will receive 75% of that. This is a 1% increase and the second highest rate in our denomination. Pre-92 group health subsidy will continue at $75 for the retiree and $55 for the contingent annuitant. The pension apportionment is set for $500,000. Our contributions to the Retiree Health Retiree Accounts, or HRA, is projected to total $1.1 million. The UM Personal Investment Plan, or UMPIP, contribution is 3% in 2019 and is extended through 2022. This is to help those affected by the termination of the retiree medical subsidy and our first-time TAC appointments. Churches fund 1% and the Board of Pensions reserve funds 2%. Clergy on medical leave will continue to receive group health subsidy through the Sustentation Fund. Mandatory funding of the post-retiree medical plans began in 2018. It's to reach a fully funded status over a 20-year period. This year's contribution is $1.452 million. The second year of funding is scheduled for 2019 and will continue on an annual basis through 2037. The funds are transferred from the pension reserve to Group Health's retiree medical reserve. As you know, we use our pension reserve to offset lower pension collections due to reductions in apportionments and church collection, providing a 2% UMPIP contribution, providing a 1% DC match contribution, funding retiree HRA accounts, retiree program expenses, and benefit administration expenses, and funding the annual contribution made against the retiree medical plan liability. The pension reserve increased by $4.5 million last year. We project it'll have a net reduction of $359,000 in 2018 and of $262,000 in 19. The Board of Pensions has decreased its apportionment request by $9.3 million from 2006 to 2018. Now we turn our attention to group health benefits, which is chaired by Mr. Jerry Massey. The goal of the Group Health Benefits Committee is to blend the use of the rate stabilization reserve with the rate and benefit changes to manage any increases to participant or church contribution rates while protecting the financial integrity of the group health benefit plan, so it's there when participants need it. Because of the existence of the rate stabilization reserve, the committee is able to take conservative pricing approaches and reduce apportionment requests. Our budget forecast for 2018 includes income of approximately $13.5 million, expenses of $15 million, which means a deficit of $1.5 million. So investment income is projected at 5%, is $949,000 plus $507,000 from the rate stabilization reserve. For 2019, we project our income to be $13.1 million. Now this is less due to the $500,000 reduction in our apportionment. Expenses of $15.8 million with a deficit of $2.7 million. Investment income will be about $1 million, with $1.7 million from the Rate Stabilization Reserve. We propose these changes for 2019. The apportionment reduced by $500,000. We change out-of-network, out-of-pocket expense from $62,000 to $67,000. This compensates our plan for discounts lost when participants go out of network. Please stay in network. We're a self-insured plan and we work hard for those discounts. The lay employee waiting period is reduced from 90 to 60 days. The high deductible plan changes will be announced during open enrollment. Funding the retiree medical liability at the rate of 1/20 or 5% per year is required by Westpath. We're very grateful for the Rate Stabilization Reserve. Extra investment money helps fund it, and we started the reserve in 2017 with a little over $2 million. And we project the ending balance in December of 2019 will be almost $3 million, helping us with cost lower in between. Our post-retirement liability as of December 31st in 17 was $21 million. Then with the payment to the Retiree Medical Fund, our liability as of January 1, 18 by the actuarial evaluation report is $18.9 million. Thank you so much for your attention and the opportunity to serve. We look forward to seeing you at the annual conference. God bless you.